Wonderful people, welcome to my channel. Let's continue the final part of osteoarthritis or bone joint inflammation. If you've not watched that of part 1, you can pause the video here and start from there. Let's start. To throw more light on people of high risk of osteoarthritis, this medical condition can be inherited. That means if any of your family member is suffering from this kind of condition, your chance of inheriting can be high, or having this condition can be high. Mechanical stress can also cause osteoarthritis. In terms of infections to your joints or non-inflammatory to your joints can cause osteoarthritis. Previous injury to joints can cause osteoarthritis. You can ask people who are having experience from previous injury to those affected joints, although we treated it, but let's say later on they can be feeling pain as a result of reactive synovitis, periarthritis, or spasm of the surrounding muscle. Let's talk about some common changes or feeling as a patient. You have to rush to see a doctor immediately. In case you slept and woke up and all of a sudden any of the already mentioned joints, be it your finger joints, your knee joints, your foot joints, any of them, your spine, you can feel, let's say, minor pain. You don't all that severe pain, minor pain. You can also see that affecting joint is swollen, and you can feel stiffness of the joints, which won't take long period, let's say less than an hour, and all that sign will vanish. It will reside without adding any medication or taking any medication. I know for you will think all is well, so you go for recce, and from that long day activities you get home and the pain will start again. That shows you have to see a doctor. Don't start your own medication. That self-medication, I always say, I don't really know what you are treating, because any stage of osteoarthritis would demand a perfect treatment or management. For instance, yours may not be all that serious. You may need just a therapeutic management or basic management, or let's say sanatorium and spa management, which we won't know until you come to the hospital. So don't waste time, because the more you waste, then you will be increasing your risk. It can even get to a stage where there will be osteophytes or outgrowth of a bone, which there will be the need of reconstruction or surgery, which shouldn't be that way if only you can visit the hospital or any health center as early as possible. About the most interesting part of this medical condition, that's osteoarthritis. It can be prevented. We have primary prevention, which can start from childhood. Whilst the kids are going to school, you shouldn't be loading them with that bag with huge load, which will cause scoliosis or abnormal curve of their spine. Remember, I said gradual, continuously, progressively deterioration or wearing away of those involving joints will cause osteoarthritis, and every blessed day the kids will go to school, so always with that huge bag, gradually they will be destroying their joints. So take note of that. And in school, they will be doing one position for a long period of time. That's teaching and learning. So whilst they are seated, give them a comfortable desk, which will help them and prevent all those involving joints whilst sitting from pressure and stress, and at the end of the day it won't cause any osteoarthritis, or long time they will not be suffering from such condition. In terms of physical education, you can involve the kids in physical exercising. Even adults, if your age is suitable, you can join in terms of physical exercising, so that you'll be having strengthening of your muscles and your ligaments, which will prevent joint distraction. You can provide quality meal, healthy meal, have nice menu for them, which will prevent those fatty food, which will give them overweight or obese, and even take off all those metabolic disorders. That one too, adults can join to prevent them being obese over their involving joints. In terms of buying them shoes, as parents, you should be buying them those insulin for correcting of flat feet. Don't be buying most of the high heels for them, those teenagers. Even if you buy, don't advise them, not letting them be using them always, so that they won't be stressing those foot joints and all those involving joints. As women also, we can practice that. We shouldn't be always using those high heels to prevent our joint from distraction. We can also talk about, in terms of secondary prevention, as an adult you have to limit labor. Even if you can't put a stop, limit those labor. Take dose of walking, make sure you go for your basic therapies in terms of necessary, and make sure, even if you are a driver, you have to advise yourself, going for long journey 1 day or more, you will be sitting one position for long period of time, stressing some involving joints, your spine is at risk. So advise yourself and make sure any little time you get, you won't be sitting, but you will be taking walk to prevent you from destroying all your joints, and at the long day you will be having those osteoarthritis. Please take notes and take all this advice, because if you do not take them, at long run you can become temporary disabled. You need maybe an aid to walk, maybe walking stick to walk, or permanent disabled, whereby even if we give you aid, you can't be using it to walk, you can't walk again, which will even cause you more harm. You have to quit from your profession, which won't be enjoyable to face such condition. Thanks for watching. Share, comment, like and subscribe to my YouTube channel, Doris Opompuku. Thank you.